if I had cheese.
You have cheese. No editing. I said that we would do an interview with somebody on Wednesdays, and things took a little bit of a turn where I was going to be at the clinic, and then now I'm in Winkler working, which is just as good and fun, but I still want to do an interview. And it worked out good because I've wanted to talk with Felicia for a while because she's with me all the time at the clinic and does all the therapy stuff. And a majority of people know her, but there's actually quite a few that still don't. And so we want to kind of let everybody know what she's around and what she does, because it's incredible. An example, before I let her talk with me here, is today, so in Winkler, this lady walks in and just kind of stone cold face, not really letting us know her vibe, if she's into this or not, or kind of what. So we do our thing and we assess her. And I'm talking about right off, you can see inflammation in the hips, and your nerves, like your sciatic all the way down, is just shocked, like pinched and blocked. There's no way you're not feeling pain. And she's just still kind of not, what'd you say? Okay, just letting us do the test, which is, you get that a lot. But then at the end, I took a picture of her actual eye, and then I showed her this, and I said, this here means the nerves, there must have been an accident or something in your life, because the nerves, the sciatic, it just completely jammed and causing a lot of pain. But this means a prolapse. So that could be your uterus or your bladder or something, but because of all that, it's actually fallen. And at the end of the assessment, she kind of just sat down and totally just teared up. I was like, I'm overwhelmed. Like, wasn't even sure what to expect, and you guys just pinpointed exactly what's going on. But the best part was, after this, I let Felicia do her thing and work on her, and I went to go get some lunch. I met her on the elevator coming back in, and she was like, I was so desperate and sad coming here, and then I'm leaving full of joy. And she actually brought like a couple more of her family members to fit in and squeeze in after today. It was really, really fun. But the point was with what Felicia does. Because a lot of the times what you'll get is, I don't want to go to a chiropractor. They pop, they snap, I don't feel better after, you gotta keep going back. Which is where this is a beautiful thing, because as I explain to clients, is that if something goes out of place, like your neck or your back, knee, anything like this, it's the muscles, the fascia, the tendons, the nerves that need to be addressed more so than the actual snapping and the adjustments of the bones. Right. Sometimes you have to do that, but mostly it's just what you do.
Yeah.
And again, there was another lady that came in falling all the time.
Elderly lady.
Yeah, and so it was something to do with her knee. We were talking about it, but what was that, or what like? It's just the muscle that pulls?
Well, it's a combination from coming from her hips, right? And the sciatic nerve runs from the feet and can go all the way up into your shoulders. Yeah. But there's also tendons in the back of your calf. I can't show you my calf. But there's pressure points essentially right in the base. Yeah. Right behind your knee. And hers had jammed up so tight that she didn't have mobility and her knee was giving out. So...
Yeah, it's crazy. And you probably find too a lot of your stuff that, because I work more on the nutritional side, and that's why I made Felicia, because she does all the physical ailments that people go through. A lot of the times, I don't think people realize there's a connection. Like, oh no, my hands are falling asleep. Okay, well, it's your neck or ribs. Like, right. No, it's my fingers I'm talking about. So it's really cool how you go in and just move it. Like, for example, this lady we're talking about, she's sitting on the couch here, and then Felicia just goes up and grabs underneath it, and you could see like her whole face just popped and changed. But she was like, "What did you do?" And then she was so happy, and she wants to see her again, because one subtle movement, and she fixed the pain that she was feeling in her knees, which is, it's incredible. It's incredible. But so with what you do, what I think I'd like to ask you, just so people understand a little bit more, is how you kind of got into this.
Well, going back to being pretty much born with type 1 diabetes, I struggled a lot in life, and health-wise you got the medical system, and that was pretty much it at that time. And then I got introduced to Terry. Right. And that started the whole herbal aspect of things. And then through that introduction, it led me to meet other people. And I've always been a hands-on kind of a person. Right. That's what I do, and I like action more than talking. Ha ha.
No, that doesn't surprise me. Yeah.
So that through a lady that I met through essentially Health Trek and the conferences, I started training with her for about trained with her for 2 years with pressure points, reflexology, moving tissue and fascia. It's some types of massage, but that's basically it. A lot of pressure points. And then from you, I learned a lot of stretches that I can implement into it as well.
You definitely have that. See, it's like a catch-22 thing. I think a lot of things in life, like muscle testing and what you do, Felicia, you could argue that, they say anybody can do it. And I think if you have the willpower, you can. But some people have like a gift and a touch to make it really work. And clearly you have that. And that's why we were laughing about the action more than the talking thing, because we were having an inside joke on the drive here about how Felicia just, once she gets the people, she can do it. But the explaining things or the conversation before that is an area of struggle that we laugh at all the time. It's inside joke there. But no, that's incredible. So chiropractors, people think of, my shoulder's out, my neck is out, let's go get it fixed. But with what you do, and why I was so excited to bring you along too, is because you do things that are, people, when you say like bladder, for example, other things, they go, what, that's possible? You don't just need surgery? So what are the other kind of things that you work on that are not so much typically known that can be worked on?
Well, there is like bladder lifts that I'm able to do, which also will realign the uterus. So it'll lift it all up. And then men too, obviously, but don't lift their uterus.
Their uterus is usually okay, yeah. Well, you never know now. Oh, they could.
And then plantar fasciitis, like people, I've had some clients that have been off their feet because they walk on concrete all day. I've had a nurse who had to quit working because she could no longer walk, and came in, and it took a while to work the feet, but you work the like your fingers, right? They're supposed to move, but when your foot becomes a paddle, it's going to create so much pain because it has no mobility. So then you have to work the feet and the tendons within the feet to loosen them up so that they can have the flexibility to walk again.
And there's also, because one of the things when we test certain things too, there's something basically called organ placement too, because a lot of the times it's not where it should be. Like someone's like, the thing about a fallen bladder or prolapsed womb is because it literally means it fell. It's not in place of where it should be. But I think that goes the same true for like even stomachs and small intestines.
Yeah, and I have a technique to lift the stomach as well.
Right.
As well as bowel. If there's a knot or a twist or even something, like a lot of the time people have blockages. And that's one thing, but then when there's a twist that has to come undone, I also have a technique.
Yeah, because I think that sometimes certain things too, herbs work 90% of the time for things, but not all the time. We actually had a gentleman in today too, and this is kind of where I'm going at, where every time he'd come in, we would point to this obstruction, pretty much this blockage in the bowel, right here for years going on. And someone was actually finally working on that and moving it, and it changed. But herbs, you can take all this stuff to get there, but the herb won't actually get there. So there's lots of times when I've even told clients, I'd like to suggest this product to this, but you've got to see Felicia and get this worked on first. It's a fascinating concept because the body works off of electricity and nutrition all the time. So I like to say, hi, I'm nutrition, nice to meet you. Felicia's the electrical point of view, not saying that she's hooking you up to batteries and sparking electricity. It's because
I might.
Yeah, that's actually true. I should watch what I say there. It's because when you have a blockage, if your neck is out or your finger is out of joint, these are meridian channels that need to be functioning perfectly. And it's part of healing. It works on the nervous system. It works on how the heart is functioning. There are so many times where we can say you need this selenium for the rhythm of your heart. But if you don't put your rib in place, or you don't put the nerve or open up that meridian channel to the heart, that nutrition's not going to work. And that's where I've seen what Felicia does just excel. And that's things that I can't touch. I don't know how to touch. I don't want to touch. But it works.
Well, that's the thing. It's a combination of doing the internal herbs and doing a combination with the physical. That's like, I actually don't prefer to see people who haven't already started your program. Because your body has to have a certain frequency and energy.
You were saying you notice a difference, you can
to
tell.
hold placements.
Yeah.
right? When you're physically taking the herbs already for a while, your body allows for different things to be moved and adjusted and to hold much longer.
Yeah. Well, that's true too.
Hmm
I don't think of it like that, because I guess otherwise, why that would be true too is because some people go to massage therapists or chiropractors and then just say they hurt me so much or I'm aching so much more.
hmm
But really, that's lactic acid that builds up in your muscles and tendons that when you hit a trigger knot or whatever releases it. If someone was coming to see you and you wanted them to be on things before to help with the muscle pains, like what are some things that you would suggest people could start taking at home?
Like the very basic.
Yeah, just to get their system kind of right.
Well, it's always magnesium.
Magnesium,
3
yeah.
is, the combination is great. Doing the baking soda,
Huge,
because that alkalines your body when you won't be in so much pain. When I work on you, then it'll adapt easier.
Mm-hmm.
Those are the main, and salt.
Salt.
The sea salt and water. So your electrolytes are...
And it's a half a teaspoon of baking soda is
Right.
what we like to
Suggest,
suggest to people. And you know what? When people do that, like, I don't know of anyone who hasn't done that on a regular basis that didn't come in with saying something has changed.
Mm-hmm.
Either they just feel more alert through the day. Sleeping is the number one thing that I find. They can sleep better because when you take a half a teaspoon of baking soda and a glass of water before bed, you are alkalizing your system to help put the body into that REM of sleep that actually needs to go deep and actually heal the body, which is, I think a lot of people sleep, close their eyes and wake up and say, I had a good sleep, but you didn't actually have a good sleep. And that's the difference. I just enjoyed sending people to you that I knew were in pain but didn't think anything could be done with it, and then watching them come back just smiling. Like that was incredible, because like I said, this lady today, and that's kind of what sparked us to do this interview today, is you could see the helplessness on her, and just like, and then she's just crying. I'm like, okay, Felicia, you got it. I'm gonna go for lunch now. And I left, and when I came back, she was just
The difference. Yeah.
the energy, the color. She's like, I'm leaving here happy. And then all of a sudden, next thing you know, knock on the door, and she's bringing family members and stuff back, which is what you want, but you got to experience it. People live their whole life thinking nothing can be done except for surgeries. And don't get us wrong, time and a place.
Right.
Bone breaks, not going to touch you. You need a chiropractor. There's always a need for those types of things, but 90% of the time it can be fixed by just aligning the muscles and tendons like that. That's great. And then feet is another big one, because
It's your platform.
that's literally what holds you up.
It really does.
Is the feet. But there's things like plantar fasciitis, right?
That was the one I talked about, and then calcium deposits.
Calcium deposits. Yeah. So what is a calcium deposit?
Well, when you get it in your foot, it's a heel spur.
Oh.
Right?
Okay,
Like that.
You hear that a lot.
Yeah.
Heel spur. And
that's, I can also help to alleviate that.
I don't know why heel spur. I always think of that little spinning thing on a cowboy boot.
Yeah, you do.
Is that what it is? Is that on the heel?
Well, it's jabs every time you step, right?
It's a heel spur, cowboy boot, yeah.
Calcium jamming into your...
So how do you relieve that?
Well, you have to break it up, essentially. So...
Fun.
It's uncomfortable.
Okay, so let's talk about that. Let's talk about that. The, no pain, no gain, they say sometimes, right?
Yep.
Okay, yeah. I'm not gonna get into that story, but with what Felicia does, it's sometimes it can be fixed in one shot because it's so effective. Sometimes you need to coming back, but chiropractics are more in a movement of breathe in, breathe out, and then they do the adjustments really feel more of a pop, because that's also tendons releasing, air pockets letting go, things like this. But when Felicia works, for example, like if I had a jam here, she'll take her finger and like move it through and literally break up that knot. So it's done on the spot, but it's not a relaxing spa day. But it's just not. But honestly, I've never seen something so effective for working on things out of place. Now, I'm not talking about massage therapy and physio and stuff. Those are different categories. Right. This is more when I send people to her when there's a nerve pinched blockage or like an organ or gland that's really out of place. I think it seems kind of like the majority of women are walking around with their uterus or their bladder not in place.
Lots. And they just accepted that that's how it is.
So it's like, what kind of, trying to think what kind of symptoms, like how they know that it's out.
Well, it's bladder leakage often, right? And
Right.
frequent urination, but that could also be other things that cause that too.
Okay.
But it can be lower back pain. You can feel a sensation of burning in one of the hips, because that's where when it moves, it can slide into either the pelvic floor, drop to the pelvic floor.
That was in the next, like, where did
It gets stuck in the pelvic floor,
Where
and
did
then
it go?
after it's tired of being there,
Yeah,
it can slip into the hip joint.
that's crazy.
And then that's when the hips will fall out of place,
Yeah.
and then the sciatic follows suit. So almost every person that comes through my door, I start with the bladder, just to make sure it's in place so the rest of the body can follow in alignment with
Yeah.
the hips, and then you can work up the spine to straighten everything out from head to toe.
So, and that goes with the category too of what I will say to a lot of the clients, and with what Felicia is doing is every single thing in your system is connected. So I went to Abbotsford once and I was doing a clinic there, and this lady came in. I just finished a speech to all of them saying, if your fingers are and your eye twitches and it's not separate, it's all connected. And then she came and was like, I just got back from my doctor and he said, stop thinking everything's connected. If this hurts and this hurts, that's two different issues. You're not going to get anywhere if that's how you think, because every nerve, everything is connected. Mm-hmm. So like what she was saying, so if your bladder's out of place or it's fallen like that and you keep having neck pain, you would think bladder here, neck here. It's connected. Mm-hmm. So that's where one of the things is where even if you're not sure, coming in with Felicia for her to even just assess and see what's out or not out would be a huge thing for issues that you're in pain with, mm-hmm. that you have not yet received an explanation for. Because if your neck is out and you go get an x-ray and they go, look, these discs are seized or this is happening, there's difference. But the amount of people that walk into our clinic doors that have an immense amount of pain with no answers is unbelievable. And then to say, look what's happening here, and then watch Felicia just move her hands like that and then see it changes, it's literally night and day. Mm-hmm. It's insane.
But sometimes I've had ladies or men or women or whatever walking in bent over and they leave upright, right? Because of their lower back and sciatic has been out for quite some time, where they're no longer able to stand up straight.
They weren't just walking in looking for the quarter they dropped from the floor, right? You gotta find out where it is. Oh, that's such a bad joke. I had to say it. You gotta watch.
Oh, wow.
Today was a good day. Today we had a lot of things, and sometimes when clients will say some things, I just spit little jokes out that really aren't that funny. But it catches people off guard and makes them laugh. One of the things I told, this isn't funny when I say it, but it was when it happened, was I remember writing for Terry and this lady walked in and was just like so scared and full of almost terror, like what is happening here, what's going on? And Terry was like, okay, I just want you to stick your tongue out at me like you're mad at me. And she stuck it a little bit. He's like, not that mad, what did I do? And how he said that caught her off guard and me so much that the entire point was just us laughing, and the laughter just kicked the whole energy and changed it up. But yeah, what Felicia does is out of this world incredible for the body. And that's also why we're doing the video, because some people don't know that she's at our office in Selkirk and she's there pretty much every day. It's incredible. Like, I mean, if you've been suffering the stuff, and people that have come in with like diagnosis of insane arthritis, and it just turned out that one tendon was flipped over or something, and you can fix it right away.
Mm-hmm. Same with what do they do when they always cut this here? It's just left my brain. But then you have to work the hand.
Right, yeah.
Like when you are on the computer too much.
Yeah.
But there is also a way of working the hands to alleviate some of the stressors in your wrists.
So so do you think stretching on a daily basis is good for people to prevent this?
For sure. But I mean, once it's to a certain point,
it's too far.
You need help.
Yeah.
And then the stretches would be helpful afterwards, which I often talk to people about doing after they leave my office too, is stretches that they can do to maintain.
And that leads to the last little point of what we're talking about, which is, because we're talking about the physicality of the body, is that our bodies are meant to move. Mm-hmm. One of the things that Felicia and I see a lot with our clients is that They can do everything right supplement-wise, diet-wise, belief system-wise, but they're missing one thing. And that one thing is movement, exercise. You've got to actually move. Like when Felicia first started coming on the road with me, I think if you scan through her camera, there's a whole bunch of pictures of me basically in weird positions because I was walking, pacing back and forth constantly. There's a peephole in the door. I always look at the peephole to make sure no one's waiting.
I think every road trip I take a picture of you staring at the peephole.
I'm just, who's out there? I'm always looking.
Now we're going to have to post one of those pictures.
We'll post one. In the comment section, we'll post a picture of me. We're not just making that up. But I'll jump up and down, jumping jacks. Felicia's doing push-ups and doing things. We're constantly moving our body. When you move the body, the chemistry changes in the brain. You feel way more upbeat and positive to make a change. Same when I'm testing that. Someone comes in, it's family, energy's high. All of a sudden there's a half-hour break and Felicia and I are like this. Once we get up and move or start testing again, the whole energy changes and comes alive again and you feel way better. So the reason I wanted to talk with more about what Felicia's doing is to let you guys know that what she does is incredible and you've got to come see her. But if you're asking yourself, well, I have a chiropractor or a massage therapist, and so why? It's because a lot of them don't touch the pinched nerves or the tendons or the fascia. And if you keep going and get some relief, but you don't get all the relief, not knocking any other modality because they're all incredible. Give her a try. It's absolutely incredible, especially if I think that the fall in bladder happens a lot, and you would assume uterus too, but after women have children too, right?
For sure, yeah.
Yeah. And one other thing too I know about the fall in bladder is, or the uterus too, if it's out of place like that, because your stomach and everything go too. A lot of women are afraid to mention this, but sometimes they have very painful intercourse all the time, and they don't know why. They think something's wrong with them. They kind of keep that inside and don't like that. Move their hip or go in and do the bladder like Felicia does. And by the way, when we say go in, this is non-invasive. She does it all through the top. This is nothing is invasive at all. But it moves it, and then instantly it's better. So, Selkirk, Manitoba, our clinic.
Be there.
That's where you can find her. Have yourself a great night, guys.
Bye.
Bye.